Hello, my name is Daria Barwinska, and it's a pleasure for me to be here to be able to present to you one of the studies I have been working on recently in the lab of Dr. Keith March at Indiana University. So today I'm going to talk to you about how the habits of your daily life can possibly affect the quality and the vasculogenic potential of stem cells. Specifically, I'm going to focus on cigarette smoke and potential mechanisms that can be used to repair it. First of all, I'd like to tell you what are stem cells. Stem cells are these very special types of cells that can divide and either create an identical copy of itself, sort of daughter sister cells. These copies are also known to produce or secrete several different factors or chemicals that are known to have healing properties, that are known to stimulate more vessel production, that act as anti-inflammatory agents. At the same time, these stem cells can also go in a different path, and they can become differentiated or specialized cells. In our case, since we are working with adipose or fat-derived stem cells, they can become either fat tissue or adipose tissue, bone or cartilage. Another great advantage of using fat-derived stem cells is that they can be very easily obtained through a minimally invasive procedure of liposuction. And at the same time, once you obtain that adipose tissue, the fat tissue, you can receive a lot of different cells or a lot of cells coming from a very small portion of that tissue. So there's a huge advantage because you get a lot of cells from a very minimal amount of tissue that's really necessary. This slide presents you with several different areas or diseases that our lab is focused on. In fact, we are doing work that's related to even more diseases than listed here, but these are just some of the examples where adult stem cells have been shown to offer promise as a therapeutic agent. So we have diabetic retinopathy and various eye diseases. We have emphysema and acute respiratory distress syndrome. So these encompass lung problems. We also have treatment and prevention of various heart diseases and heart failure, treatment and prevention of type 1 diabetes. Adult stem cells have also been used extensively in wound healing, and they show a promise in that area as well as peripheral vascular disease and nerve damage. So why focus on cigarette smoke in the first place? Well, we know that approximately 20% of the population in this country still smoke cigarettes. Now, a little less than 500,000 of people will die each year from various diseases related to smoking. Smoking is also known to cause peripheral arterial disease, or PAD. It's a very debilitating disease that's characterized by severe pain in the legs, at rest or during walking, so patients are unable to even sleep at night because the pain wakens them up very often. They are also very often put on very serious painkillers, and their quality of life is severely diminished. We know that approximately 12 to 14% of adult population will develop PAD at some point in their life, and that number actually increases to 20% when the individual is 75 years or older. Now, when PAD is not treated, or when it progresses to what's called chronic limb ischemia, then the patient is very often faced with a dire diagnosis and option of treatment, which is limb amputation, and this is specifically what we want to avoid. So what are the findings that relate to my project I have been working on? These 4 images represent what's called vascular network formation. And these have been achieved by culturing 2 different types of cells, adult stem cells, as well as endothelial cells. Endothelial cells are known to be the building blocks of blood vessels. So now if you look at the top 2 panels, the one on the top left and the one on the top right, they show very dense networks, very well branched. The networks are very long, very robust. They just look beautiful. However, now if you focus your attention on the bottom 2 panels, the one on the bottom left and the one on the bottom right, you will notice that these networks are not as dense. They are not as well branched, not as robust as the ones on top. Now, why would that be? The difference between the top and bottom is that the cells the adipose stem cells that have been used to establish these networks on the bottom have been derived from patients with a known history of cigarette smoke. So that tells you that the history of cigarette smoke has compromised the ability of these cells to establish vascular networks that are robust and dense, as we see in case of healthy donors. Now, this data can be further quantified using specific computer software that can calculate different parameters and extract different data from these images. So based on that analysis, we know that for both men and women who are smokers, the quality or the density of those networks, the vascular networks, is compromised in both cases of both genders. Now, next question would be, why is that? Why is it that these cells don't work as well and they don't produce robust networks? Well, if you remember when I mentioned in the beginning that stem cells are known to release certain chemicals, certain factors that have healing properties. So the idea is that perhaps these cells coming from smoking donors do not release factors in as high concentration as healthy cells. Perhaps they don't produce as much. So I did another study. In this case, I looked at several different factors that are known to be important for establishing new blood vessels. This is just an example of a few of them. We have HGF, angiopoietin-2, and SDF1, very critical, important factors for formation of blood vessels. And you can notice that in all cases, the amount of those factors produced by stem cells derived from donors who smoke is severely compromised. It's much lower comparing to the ones that are obtained from healthy cells or healthy donors. So with that in mind, we wanted to confirm whether we are able to recapitulate the same effect in a mouse model. For that reason, we established a smoking mouse model. We did not have to teach the mouse how to smoke, but we did put the cages in a special so-called environmental chamber. The machine was then smoking cigarettes and then puffing the smoke into the cages of these animals. When we isolated the fat tissue from these animals and then subsequently isolated stem cells and did the precisely same assay of network formation, we observed that the stem cells derived from mice that have been exposed to air, ambient air, the way you and I breathe, are healthy. And they actually do establish nice networks. And that's actually visible in a diagram on the top with the nice green networks. However, when we look at the stem cells derived from mice exposed to cigarette smoke, they almost did not form any vessels at all. And that can be seen on the bottom panel. Now, the same data can again be transcribed or analyzed by a specific software, and that also gives us the red and the black diagram that shows that cells derived from mice exposed to cigarette smoke are not as effective in establishing networks. So with that in mind, we wanted to ask another question, whether these cells obtained from smoking donors would potentially still have their therapeutic capacity. So in order to answer that, we did some animal studies. In the first study, we have injured a series of mice, a group of mice. In one leg, the other leg remained healthy. It's called a hind limb ischemia injury model. These mice have received stem cells, and our lab has shown many years ago that injection of stem cells, adult stem cells, is actually able to rescue the limb. The limb does not go necrotic. It's actually preserved. Even when the injury occurs, we are able to preserve it using stem cell treatment. So we know that. However, we didn't know whether using cells derived from smoking donors would have the same effect. So in this case, the animals received stem cells on day 32. So there has been about a month after the injury. They received cells from smoking donors and non-smoking donors. This slide illustrates the blood flow that has been measured every week in a group of mice that received stem cells from smoking donors. And you can see that there is almost no change from the beginning of the injury throughout the entire course up through the 74th week. However, when the animals received stem cells from healthy mice or healthy donors, we can now see an improvement in the blood flow. And it's actually a statistically significant difference. And these limbs were able to be saved. They actually regained the blood flow and regained the perfusion, which is what we want to see in a healthy limb. So this was a very exciting finding, and we decided to actually do a bigger study, and this time test 3 different smoking and 3 different non-smoking human donors. So in this case, after the injury, all animals received stem cells on the very next day, and then they were monitored on a weekly basis for their blood flow. Also, you will notice an image right over the diagram representing the timeline. The control animal, represented in the image here, shows the limb that's going necrotic, that has not been treated with cells, and that's not a healthy limb. However, the other image represents the nice pink, very well perfused limb, and that's the mice that have been treated with stem cells. So what did we find when we injected both smoking and non-smoking donors, or had a group of mice that served purely as a control group? We found that cells that have been derived from healthy non-smoking donors have performed very well in re-establishing blood flow in the injured limb. However, the cells obtained from smoking donors have not performed as well, and in fact, there was no difference between that group of mice and the group of mice that have been not treated with cells, that received a vehicle, in other words. So with that in mind, we can clearly see that the stem cells derived from smoking donors are compromised in their ability to rescue an injured limb. So in conclusion, there are 2 major findings and observations that are coming from this study. One is that stem cells coming from human smoking donors are inferior in supporting vascular network formation. And that can be due to a decreased amount of secreted factors. However, that is also being compared with the animal study. And our animal study also indicates that cells derived from smoking donors are inferior in their ability to rescue an injured ischemic limb. So this study is actually quite meaningful and important because it tells us that patients who are possible candidates for cell therapy, but who also have a smoking history, may not be the best candidates to receive their own cells. And in fact, the best idea or the best approach, therapeutic approach, may be to look at other donors of stem cells in order to use with these patients. So in other words, we know now that smoking is bad for your fat. And I'd like to thank you, Dr. Keith March, my PI and mentor, as well as the entire lab team. And I'd also like to acknowledge the funding sources, which is the American Heart Association, the VA Merit Award, and the Cryptic Masons Medical Research Foundation. Without you, this study would not be possible. So thank you very much.